This medication contains two hormones, estrogen, ethinyl estradiol, and progestin, drospirenone. It is used to prevent pregnancy and may also be used to treat premenstrual dysphoric disorder, PMDD, or moderate acne if you have chosen to use birth control pills as your method of pregnancy prevention. In addition to preventing pregnancy, birth control pills may make your periods more regular, decrease blood loss and painful periods, and decrease your risk of ovarian cysts. However, using this medication does not protect you or your partner against sexually transmitted diseases. Before you start taking Yaz, make sure to read the information leaflet provided by your pharmacist. It contains important details on when to take your pills and what to do if you miss a dose. Take the medication by mouth as directed by your doctor, with or without food, usually once daily. Choose a time of day that is easy to remember and take your pill at the same time every day, 24 hours apart. Follow the package instructions to find the first tablet and take them in the correct order. Do not skip any doses. Vomiting or diarrhea can affect how well the birth control pills work, so if you experience these symptoms, you may need to use a backup method. Your pill pack contains 24 pills with active medication and 4 reminder pills. Take one active pill once daily for 24 days, then take a reminder pill once daily for 4 days. You should have your period within 3 days after you take the last active tablet. If you do not get your period, consult your doctor. If this is your first time using Yaz and you are not switching from another form of hormonal birth control, take the first tablet on the first Sunday following the start of your period, or on the first day of your period. Use an additional form of non-hormonal birth control for the first 7 days to prevent pregnancy until the medication has enough time to work. If you start on the first day of your period, you do not need to use backup birth control the first week. Ask your doctor or pharmacist for information about switching from other forms of hormonal birth control to Yaz. Some common side effects of Yaz include nausea, vomiting, headache, bloating, breast tenderness, swelling of the ankles/feet, or weight change. You may also experience vaginal bleeding between periods or missed/irregular periods, especially during the first few months of use. If any of these effects last or get worse, notify your doctor promptly. If you miss 2 periods in a row, or 1 period if the pill has not been used properly, contact your doctor for a pregnancy test. This medication may raise your blood pressure, so it's important to check your blood pressure regularly and tell your doctor if the results are high. Be sure to tell your doctor right away if you have any serious side effects, such as unusual changes in vaginal bleeding, symptoms of high potassium blood level, or serious problems from blood clots. It's important to talk to your doctor about the risks and benefits of this birth control pill and to seek medical help right away if you experience any very serious side effects. If you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing, get medical help right away. And remember, this is not a complete list of possible side effects, so if you notice other effects not listed, contact your doctor or pharmacist. If you are a smoker or use tobacco and are over 35 years old, it is not recommended to use Yaz. This is because smoking can increase the risk of stroke, heart attack, blood clots, and high blood pressure when using hormonal birth control like Yaz. The risk of these serious issues gets higher as you get older and the more you smoke. Therefore, it is advised not to smoke or use tobacco while using Yaz. Before using Yaz, it's important to talk to your doctor or pharmacist about any allergies you may have, as well as your medical history. This includes conditions like adrenal gland problems, stroke, blood clots, high blood pressure, diabetes, and more. If you have diabetes, this medication may affect your blood sugar, so be sure to monitor it regularly. You should also let your doctor know if you will be having surgery or if you will be confined to a chair or bed for a long time, as these conditions may increase your risk of getting blood clots. Additionally, be cautious about using potassium supplements or salt substitutes that contain potassium while taking Yaz, as it can increase your potassium levels. This medication may also cause dark areas on your face and skin when exposed to sunlight, so it's important to limit your time in the sun and wear sunscreen. If you wear contact lenses, you may experience vision problems, so contact your eye doctor if needed. It's also important to note that it may take longer for you to become pregnant after you stop taking birth control pills. And finally, Yaz should not be used during pregnancy or while breastfeeding, so be sure to talk to your doctor if you think you may be pregnant or if you are breastfeeding. Make sure to check for any drug interactions with Yaz and other medications you may be taking. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. And don't forget to ask your doctor about any new medications you start taking, as they may affect how well Yaz works. Additionally, be aware that Yaz may raise your potassium blood level, so be sure to tell your doctor if you're regularly taking other drugs or products that can also raise your potassium level. And finally, keep in mind that Yaz may interfere with certain lab tests, so make sure to let lab personnel and all your doctors know that you use this medication. If someone has taken too much Yaz and has serious symptoms like passing out or trouble breathing, you should call 911. Otherwise, call a poison control center right away. In the US, you can call the local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of overdose may include severe nausea and vomiting, as well as sudden or unusual vaginal bleeding. It's important not to share Yaz with others. Make sure to have regular physical exams and medical tests while taking this medication, including checking your potassium blood level, blood pressure, breast exam, pelvic exam, and pap smear. Follow your doctor's instructions for examining your breasts, and report any lumps right away. Keep all medical and lab appointments and consult your doctor for more details. If you miss a dose, check the product package for instructions. You might need to use a backup method like condoms or spermicide to avoid getting pregnant. Talk to your doctor or pharmacist if you have any concerns. If you have trouble remembering to take your pills on time, talk to your doctor about trying a different type of birth control. Remember to store Yaz at room temperature, away from light and moisture. Also, keep it out of the bathroom and away from children and pets. When it's expired or you no longer need it, be sure to properly discard it. You can ask your pharmacist or local waste disposal company for guidance on how to do this. And remember, don't flush it down the toilet or pour it into a drain unless you're instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.